Hi, my name is Laurel, and today I'm going to demonstrate the Gonal-F Multidose Vial. This is utilized for more than one shot, and you'll have everything you need for multiple shots in this one box. To start, what you're going to do is gather your supplies. You're going to have your powder, so we're going to use a little bit of imagination and imagine that there's a little disc of powder in here. You've got your pre-filled, your water, your sterile water, and you've got your syringe that you're going to draw it up with. So the first thing you're going to do is pop off the cap, and you're going to take an alcohol wipe, and you always want to alcohol the top of the vial before you do any mixing or drawing up. You're going to take the cap off of your sterile water, put it right in the middle, and put all of the water into the vial. And you're going to notice that there's a lot of pressure that builds up in there because you've just added a lot of water, a lot of pressure to this, so that your syringe will go back up, and that's perfectly fine. This is all done now, and you put it straight in your sharps container without recapping. Then you're going to slowly just swirl this a little bit, make sure it's completely mixed. And you can put it up and down a couple times. You just don't want to shake it vigorously because that's going to create some air bubbles. Now you're going to take your needle and syringe. This already has a needle on it. So what you're going to do is find your dosage on the edge here. I'm going to use 300 because that's a common dosage. You're going to put 300 milliliters or units of air in there. And since I just alcoholed the top of that, I'm not going to do it again. Put the needle in the middle, push the air in, and then without taking the needle out, just invert the whole thing. Pull back till you have your dose. I'm going to use 300, as I said. If you have a large air bubble at the top, you can push it out and draw back again. And then push to the 300 line. Once you're at 300, you're going to re-invert and take it out. Now to give the shot, you're going to pick a spot on your abdomen. It can be anywhere where you can pinch the fatty tissue, but stay at about an inch away from the belly button at least. Pinch your abdomen. Go in at a 90-degree angle, like a dart. Let go of the pinch and inject. Have a Kleenex handy so that after waiting about 3 seconds, you can pull out quickly and hold the Kleenex against your skin. Now, in about 3 seconds, you check your skin. If it's dry, you're done. If you see medicine leaking out or if you're bleeding a little, it's okay. Just keep holding until it's dry. Now, this is going to go in the sharps container. And this vial still has lots of medicine left. So you're going to want to put this in the refrigerator for your next shot. And that's all there is to it.